This is WFYI News Now. It's August 23rd, and I'm Abriana Herron. On today's show, several lawmakers want the Indiana FSSA to remove a policy from the Healthy Indiana plan that has been linked to loss of coverage for Medicaid members. And it's natural disaster season in the Midwest. The severe weather can have long-lasting consequences on community health.
Obviously, it'll be definitely something with mental health that it'll be a long-lasting effect. The PTSD, the trauma that was inflicted upon multiple people.
Those stories coming up. But first, Indiana counties are in charge of many water issues. That includes hazard mitigation plans and drains. But most counties don't have the resources to adequately track water quality. Side Effects Public Media's Elizabeth Gabriel reports on county-level efforts to address that problem.
Over the past 3 years, Morgan and Hamilton County have been tracking their water quality using over $3 million from the state budget. They're the only two in Indiana that track this on a county level because most communities don't have the funds to complete these studies. Hamilton County officials say tracking the water data helps city planners gauge how much water is needed as population levels change in the coming years. Water advocates hope the state will provide other counties with funds to track their water quality. Elizabeth Gabriel, Side Effects Public Media.
Several lawmakers want the Indiana Family and Social Services Administration to remove a policy from the Healthy Indiana Plan, or HIP, that has been linked to loss of coverage for Medicaid members. Indiana Public Broadcasting's Abigail Ruman reports the calls to reevaluate power account contributions come as the state continues to appeal a federal ruling against the policy.
Power account contributions are monthly payments required to access the version of HIP with better coverage. In June, a federal ruling determined several HIP policies, including those payments, go against the objectives of the Medicaid Act and limit coverage. Representative Ed Clear says it's time to revisit the original policy argument for including the monthly payments, which was to promote personal responsibility in healthcare coverage for the Medicaid expansion population.
Our definition of personal responsibility has been focused too narrowly on financial contributions, and it fails to recognize many of the realities of the covered population.
Clear says many members already demonstrate personal responsibility in meaningful ways. He says the General Assembly has the ability to provide members with better tools. For Indiana Public Broadcasting, I'm Abigail Ruman.
The state Medicaid director says FSSA is working to maintain the status quo of the program. And for our final story today, it's been an active natural disaster season in the Midwest. Some extreme weather events like flooding are due to climate change, while others like tornadoes are fueled by factors like warm and cold jet streams getting trapped in an active storm. These natural disasters strike in a matter of minutes, even seconds. But Side Effects Public Media's Natalie Krebs reports they have many long-lasting consequences on community health.
It only took 1 minute for an EF4 tornado to rip through the small town of Greenfield, Iowa last May. Flying debris and fierce violent winds with a speed of more than 180 miles per hour severely damaged more than 100 houses. It also blew out the windows of the Adair County Memorial Hospital and sent a car flying into the side of the building.
There were glass shards on our walls, so we had to essentially tear everything down, re-drywall it, and then repaint it.
That's Catherine Hillestead, the CEO of the hospital. She's standing in the medical surgical unit. She says every single department sustained damage. 3 months after the storm damage, the hospital has just started to reopen. Over the summer, some services were relocated to the elementary school across town. Hillestead says many residents have also had to travel as far as an hour away for care. She says even though these issues should be resolved in the coming months, she expects that terrifying afternoon to impact the community for a long time to come.
Obviously, it'll be definitely something with mental health that it'll be a long-lasting effect. The PTSD, the trauma that was inflicted upon multiple people.
Sudden extreme weather events like flooding and severe storms can have many negative consequences for mental health, including trouble sleeping and depression-like symptoms. A growing body of research has linked climate change to mental health concerns. Scientists have not conclusively linked tornadoes to climate change, but the emotional impact can be as devastating as other climate change-related disasters. Tammy Jacobs is a hotline manager for Iowa Concern, which provides resources after disasters. She says often issues like post-traumatic stress disorder don't show up until months after the event.
Whenever it starts to, the sky gets gray and black again, then those who've experienced tornadoes, they just start to remember that experience that they had with the tornadoes.
Jacob says many people also face ongoing stress trying to figure out disaster assistance options and what to do with their damaged home.
The majority of folks don't have flood insurance. Their homeowners insurance will pay for very little of the things that were impacted. So just the frustration of working through trying to rebuild.
And when people aren't able to do things like properly dry out their houses after a flood or tornado, it can lead to other health concerns besides just mental strain. Alicia Vasto is the Water Program Director at the Iowa Environmental Council.
Standing water in a home for a long period of time can create a bunch of indoor health hazards like mold. It could also create like a breeding ground for mosquitoes, which are, of course, vectors of disease.
Vasto says she also worries about drinking water contamination when floodwaters push agricultural chemicals, sewage, and other hazards into water supplies.
Private wells or public water sources where they're drawing that water from and have increased amounts of bacteria or other kinds of chemicals that would be dangerous to human health.
These health concerns will continue as extreme weather events have become more common due to rising temperatures from climate change. Maureen Litchfeld is an environmental health expert at the University of Pittsburgh. She says policymakers need to create a comprehensive plan to address climate change, and they should work with communities that are affected by extreme weather events.
They might not call it climate change, but if flooding or tornadoes are their concerns, we need to meet them where they are, and we need to come up collaboratively with solutions.
She says until this happens, communities across the Midwest will continue to be hit with extreme weather events and the lasting impacts that come with them. Natalie Krebs, Side Effects Public Media.
That's all for today's episode of WFYI News Now. Our podcast is produced by Drew Daudelin with support from the news team at WFYI and public media journalists across the state. Our news director is Sarah Neal-Estes. Kendall Antron produced our music, and I'm your host, Abriana Herron. If you liked today's episode, remember to subscribe and share, and follow WFYI on Instagram, Facebook, and YouTube to check in on our newsroom throughout the day. Thanks for listening. We'll be back on Monday.